Hello friends, I am Dr. D.S. Solanki. I am orthopedic surgeon and joint replacement surgeon in Artemis Hospital, Gurgaon. So this is to inform you that we are starting robotic knee replacement in our hospital. So at the outset, I just want to inform that robot can never replace a surgeon. Surgeon has its own place and they cannot be replaced. But the robotic surgery is to help us in achieving the good results. So our robotic replacement machine is fully automatic. Means once we feed the CT scan data in the machine, it will do its bone cuts without interference of the surgeon or assistance of the surgeon. The advantages of robotic surgery are that when you do the surgery, the cuts are very accurate, so the alignment of the bone limb is very accurate. So once the accurate alignment is achieved, the longevity of the implant is very perfect. So the results which we used to achieve maybe without robotic surgery of 15-20 years, that longevity of implant might go to 30 years, 25 years. So that is one advantage. Other advantage is that there is less blood loss, the recovery is faster, and you don't need to open the femoral canal. So when you don't open the femoral canal, there are less chances of fat embolism after the surgery. So once the recovery is faster, you can discharge the patient faster also. So after 3-4 days, usually you can discharge the patient. Previously, without robotic surgery, we used to discharge the patient around 6 to 7 days. We welcome you to the Artemis Hospital for robotic knee replacement. Thank you very much.